Hello, this is Marshall Riddle from MCL, welcoming Sander Domaszewicz, Principal at Mercer Health Benefits. Thank you for joining us, Sander.
Thanks, Marshall. Appreciate it. Today I'm going to be covering information about employer-sponsored health plans and talking more about the trends that we see around consumerism, consumer-directed health plans, and health management with incentives. Hopefully you have the information right in front of you. Flipping to page 1, we like to set the stage to talk about the cost environment that employer-sponsored plans are under. And as you can see from this graph that goes back a good 20 years, it's been pretty unpredictable for employers in the first 3 quarters of the graph. But the last 5 years or so has been a relatively stable environment in the 6 to 7% range. Relative to some of the past spikes that we've seen, that's a pretty good situation for many employers. But as you can see, some of those lines running below there that represent workers' earnings and overall inflation, some of the other economic indicators that are out there, you still see a meaningful gap between the other economic indicators and the cost of health care. And that movement between those two is what's causing folks to have pain over time, because it really extends and expands the cost of health care and makes it unsustainable in the long term, both for workers and for companies. So that's really why employers are thinking about solutions that are outside the box, that are changing what they're doing today, in addition to trying to react to healthcare reform and the additional costs that may come online with that. If you flip over to page 2, one of the things that's been kind of a tried and true staple in employer-sponsored plan tactics has been to say, gosh, we're going to ask the workforce to pick up some more or different parts of the tab of the healthcare bill, either through employee contributions. In this case, on page 2, it's representing the deductible that's associated with a preferred provider plan, which is the most common type of health plan that employees are enrolled in. And you can see that the average deductible for all health plans over 10 employees is up to $1,200, which is significant in terms of its magnitude. And interestingly, in 2011, 2010, that is the minimum deductible for an HSA-compatible plan as well. So we've now reached a point where an average deductible for both large and small employers is at that level of an HSA-compatible plan. And folks, whether they're in a consumer-directed health plan or not, are being asked to pick up a meaningful portion of the cost of the care when they go seek that care. So looking at page 3, what that's doing, even with those benefit changes over time to try and mitigate the costs the company are seeing, we're still seeing some pretty meaningful dollars associated with the cost of care. Large employers took it on the chin this year relative in 2010 compared to smaller employers, with an 8.5% increase and only a 4.4% on the smaller employers. But in total, when you combine the two, we're still looking at about a 6.97% increase in the $10,000 range. So fairly significant, pretty substantial issue that employers have to deal with. So a significant portion of total compensation when you look at the pie. Switching to page 4, this kind of goes back and pans through what some of the plan design offerings that folks have adopted over time to try and mitigate some of those costs and to try and manage the healthcare expenses. You can see that the PPO area there in the 2010 line, the top line, 69% of employees are enrolled in preferred provider organizations, 19% in HMOs, 11% in consumer-directed plans that include health savings accounts or health reimbursement arrangements, and just 1% in indemnity plans. You can see that the PPOs are really where most employers are focusing their energy, but there's a significant growth, and you can see that trend line on the right-hand side there of growth in account-based plans with HSA-compatible plans or health reimbursement arrangements. And we believe that that trend is going to continue based on the strategies that we're seeing with employers we work with. We're only going to see a continued significant growth in that particular percentage. So if you see that go to 11% in 2010, that might be 13 or 14% in 2011, and based on strategies that we're seeing, will continue to grow at that level or more for the foreseeable future, as it's a significant tactic under healthcare reform. If you flip to page 5, you can see that a breakout in terms of offering account-based consumer-directed plans with CDHPs. And again, this is still based on our survey data of almost 3,000 employers in the U.S. of 10 or more. And all this data is statistically projectable, because it's done in a fashion that you can work back to statistically projectable numbers. The growth there in the blue box with the jumbo employers is marked in terms of the number of employees that they're able to get to enroll in consumer-directed plans. You can already see that, in 2008, the bottom left number there, 45% of those biggest employers out there, the jumbo employers, had been offering a CDHP, but they hadn't been all that successful in structuring plans to encourage employees to take that step of adopting the plan when it was offered alongside other options like PPOs and HMOs. But you can see in the 2010 that there's almost a doubling compared to 2008, up to 15% of employees enrolled in those plans. So it's the equivalent of same-store growth within consumer-directed plans. You see some modest continued growth of new employers adopting these plans, but then the number of employees actually selecting that option within the folks that offer those plans is growing pretty steadily and strongly. So we're seeing account-based plans being a meaningful tactic, and employers are doing that through a number of means. They're asking folks to pay more for traditional plans and giving a premium break out of their paycheck to folks that take on the CDHPs, and they're also eliminating plans. They're saying, gosh, in the past maybe we had 2 or 3 different PPO options. We're going to cut out a few of those options and really make it a more clear choice between account-based plans and the traditional plans. If you go down to 6, one of the reasons that this is happening, that the 2 primary reasons that employers, mention for wanting to move towards account-based plans as part of their structure is they really want to get people more involved and informed around their health and use of healthcare services. They want more consumerism, more engagement, more accountability. But then the second piece is, of course, they hope to contain costs over time. So they hope to, mitigate the increases over time and move to a lower cost plan. You can see on average that HSA-compatible plans, and this, by the way, includes any employer contributions, and about 2/3 of employers put money in HSAs. So whatever money they put in is included in that $67.59 total there. They're significantly less expensive than PPOs on average. Now, keep in mind, this slide does not mean that if you take every person in your PPO and they're costing you $8,700, that if you just grab those same folks and put them into the HSA plan, you're going to save $2,000 a head. This does include a difference in costs because of selection, in terms of some folks decide to take HSAs because they might be in a position to not use as much healthcare services. They might be healthier. But we still see a market advantage with HSAs in terms of long-term cost trend and the overall cost related to PPOs, and even high deductible PPOs, deductibles with $1,000 or more, catastrophic kind of plans. There's still an advantage for the HSA plan and CDHP type plans. Flipping over to page 7, we think that while consumer-directed plans can be an important and viable tactic for many or most employers, we don't think they're a panacea. They're not something that's going to solve any and all problems for employers. In fact, many employers that we have that have adopted CDHPs and have all of their employees in them, they've done full replacements or that's the only plan, have still continued to want to adjust their plans and continue towards best practices. And really the other key to a viable kind of complete solution is health management and wellness plans that include significant meaningful incentives for participation. So on this slide, it kind of outlines that, we're coming up on, 4 out of 10, approaching 50% for some of the largest employers to use incentives to encourage folks to participate in health management and disease management and wellness plans. Large employers with 500 or more, about 1 out of 4 are doing that, but it's growing at a significant pace there. You can see the 21 to 27% jump is a market jump. So we really see those 2 tactics. How do we keep employees healthy, keep them well and at work and productive through wellness and health management plans, and encourage folks to use the resources that we buy with appropriate incentives. That's kind of tactic number, tactic A. Tactic B is really around if they do need healthcare services, how do we encourage them to seek the highest value service to make sure that they're looking for the right provider at the right time and getting the right procedure with the right outcome. And that one is more around the consumer-directed health plan adoption and consumerism and transparency efforts. So they really go hand in hand. Slide 7, you can see the growth in the health management incentives, and all the prior slides really around the growth in CDHP adoption. Flipping to slide 8, we did want to highlight that one of the common tactics that's being used is really to start getting people to think about the results of managing their health as opposed to just the activity. So there's a lot of talk and discussion around the appropriateness of results or outcomes-based incentives. And examples of that might be, the most common example shown here on page 8 is we're going to give folks a break off their premium if they're non-tobacco users or non-smokers. And there's a pretty strong growth there and quite a bit of traction to say, gosh, folks who use tobacco are less productive, not at work as much, and they use a lot more healthcare services. Do we feel that it's appropriate to ask those folks to pay a little bit more towards the share of the cost since they are costing more? And that's been, you can see with the jumbo employers, 28% over 1 in 4 have decided to take that method. The other interesting component that's coming into the discussion is, should we extend this beyond just tobacco use and non-tobacco use, but extend it to things like high cholesterol that may be controlled? Can we encourage folks to take the right medications, to take the right diet and exercise steps to manage their cholesterol if there's some kind of financial incentive for them to do that? Blood pressure is another example, or body mass index or waist circumference are other areas, glucose measures. So incentives going beyond just, hey, I took a health assessment, I went and got a biometric screening. They're really asking folks to take action, engage with lifestyle management programs, and in some cases actually achieve the desired outcomes of those interventions and have better health targets. Now, we see this as the real healthcare reform that needs to happen. Healthcare reform could have addressed 3 areas. It could have addressed the cost of healthcare, it could have addressed the quality of healthcare, or it could have addressed access to healthcare. And the majority of what we saw in the healthcare reform bill that's out there now, at least for the near to midterm, is around access. There's going to be a lot more access to healthcare and a lot more folks covered under the plans. But we really need to do something as plan sponsors and as folks that are responsible for the costs around the affordability and the quality and outcomes that folks are getting with those healthcare interventions. So true healthcare reform is happening. It's happening employer by employer. They're taking it under their wing with health management with meaningful incentives, as well as with consumerism and CDHP plans. And we look forward to fielding any questions that are out there about health reform and the dynamics with employer-sponsored health plans. Thanks so much.